Good afternoon, everyone. I'm Suchita Dakal from Nepal Live today. Today we have a very special guest from Water Aid. She's a country director. Her name is Tripti Rai. We'll talk about Water Aid's work in Nepal, what their specializes and what they've been doing to help our people in this country. I think they've been working with us since 1987. So let's hear from Ms. Tripti Rai herself. Welcome to the show, Ms. Rai.
Thank you.
So let's start off with our question. How would you like to introduce Water Aid to our audience? What are the major areas of work your office performs?
Thank you so much. First of all, I think as you already introduced us, Water Aid is a global organization. Our head offices are in the UK and we started to work in Nepal in 1987. Our purpose and our mission has been very focused since the day we started in 1981 and in the UK, and we've been very focused on helping enable and provide the services for all the communities all over the world, including in Nepal, to help them access safe water, sanitation and hygiene. And that makes us very special and unique, I feel, because this is an organization that focuses solely on water, sanitation, hygiene, and that still drives us in our work across Nepal as well.
Moving on to our next question, how would you describe overall hygiene and the health status of Nepal?
I think if we look back at the recent decade, we do see some remarkable progress in terms of the sanitation situation. For example, in 2019, Nepal was declared an open defecation free, which means a large number of households, more than 99%, now have basic toilets in their homes, right? We also see that more than 90% of people have access to basic water services. Again, it's about having water close to your homes when you need it. However, when we're looking at the Sustainable Development Goals and the targets that the world has set, to which Nepal is also a government signatory and has already committed to achieve the Sustainable Development Goals, in this phase we feel that some of the key challenges around safely managed services, for example, the quality of water that we drink, the services that we get in terms of managing sanitation, they are all already of a certain basic standard, but we need to be working towards improving those standards, right? So if you're looking at the recent reports, which is from the Joint Monitoring Program in 2019, we see that only about 18% of the Nepali population have access to safe drinking water, which is quite starking data. That means we are lowest in South Asia, for example, when we have water that is contaminated with, for example, fecal contamination, right? And we also see that the management of our toilets, the fecal waste that all of us humans are producing every day, it's not very efficient. So because we are not managing the waste properly, we are also contaminating the environment, the water, and also creating hazards for our health. So that way I feel that it's quite a challenging situation, and while we have made some progress, we need to step it up. We need to be advancing forward to ensure that everybody has their right to water and sanitation. And likewise, given the current context is very relevant in terms of the pandemic and how we are trying to cope with the new situation, we've seen that largely the access to even hand washing stations with water and soap is a challenge. So in Nepal, again, the hygiene facilities need to be reached by everybody, right? In all the households, in all the healthcare facilities, in all the schools and public institutions. So we are still not quite there. So while building on our successes, I think we really have to step up and accelerate progress.
What's the state of availability of safe drinking water in Nepal?
So in terms of Water Aid Nepal's work, so we've been very committed to ensure that everybody gets access to safe water, sanitation, hygiene over the years. And if I just go back to 2010, since then to now, 2020-21, we've reached over 1 million population in Nepal with either safe drinking water or good sanitation facilities, and also been promoting hygiene behavior change. So I feel that's a significant milestone and contribution of the organization in Nepal, having also been party to contributing to open defecation free, consistently working to ensure that hygiene is prioritized. So as we work in a lot of areas where either it's a rural, context, or even in urban populations. And since Nepal has now entered a federal governance system, we work in rural municipalities, we work in municipalities, and both of these have slightly different contexts and challenges. So we continue to work either to help deliver water supply schemes that are managed by water sanitation user committees in local areas where they work closely with the local government as well. We've also been working with utilities in the country where we work to help extend piped water supply services to households. So in terms of our work, we are consistently working towards helping reach people with basic services, but also help model where we can innovate and work towards more efficient systems to be able to reach people with safely managed water as well.
How do you describe WASH initiative in Nepal?
The water sanitation hygiene initiatives in Nepal I think it's good to look at the overall government context. So in the current context in Nepal, we do see that water sanitation hygiene has a level of prioritization in national, for example, policies, where in the National Planning Commission's strategic plan for the country, we do have targets to reach people with safely managed water sanitation hygiene. We also see that the Constitution of Nepal has proclaimed that every citizen should have the right to safe water and sanitation. So I think those are again building blocks to help ensure that everybody in the country is able to enjoy these rights. However, I think with the initiatives in the country, we feel there needs to be more focus on ensuring functionality in terms of making sure that the services that we set up run for a long time, that it's sustainable, that it is providing the adequate and quality services that every citizen deserves in terms of being able to drink water which will not make you sick, or use a toilet that is not unsafe. Whenever you are either in a public institution or in a healthcare facility, women and girls can use the toilets appropriately, where they don't have to struggle if they have periods, for example, right? So those kind of things we need to be working towards, and there needs a lot of, I feel, focus to prioritize water sanitation hygiene, because it is definitely a no regrets investment for any country. It's the foundation for people to live healthy lives, dignified lives, and also for all kinds of economic as well as livelihood opportunities. So we need to step it up and work towards a system strengthening approach, where we have entire systems, which is people, institutions, processes, which work together to deliver sustainable services to all the people, including the most marginalized and left behind.
As you said, you want to provide proper sanitation system for women and girls all over the country, and of course Nepal, it has always been difficult for women to use public toilets, and not only that, even in their homes they don't have proper toilets or bathrooms where they can use. So do you think that is a bit kind of problem for your campaign or for your work that you've been doing? Is it a challenge to reach these women's like up in the rural areas?
Yeah, I think it's a very important topic that you have brought our attention. And with WaterAid, we've been working very much on hygiene, right? So one of the key things around working on hygiene behavior change has also been looking at women and girls' access to hygiene and hygienic products. And this led us to looking at menstruation and menstrual hygiene and how that affects women and girls in their daily lives. So we've been working on this issue for over 10 or 15 years now. And like you said, one of our key interventions has been to work with women and girls, especially to raise awareness and sensitize them around the importance of menstrual hygiene, to be able to help them access information so they are able to make those choices for safe management of menstruation, for example, what kind of products we use, how to use them safely. It's their choice, right? You cannot tell them you use this or that or another product, but it's about making informed choices like all of us would like to do based on the information and knowledge that we have. And that's around the women and girls and their own empowerment and their own support, right? Alongside, we're also working with institutions, especially education institutions right now, and also trying to extend that to public institutions where there are water, sanitation, hygiene facilities, but may not always cater to women and girls and their special needs, because you might need a changing place, you might need a proper dustbin, for example, you might need water, to use the toilet when you are mensurating, you might have all these challenges. So we've worked in schools where we have a Wash in Schools program with menstrual health and hygiene management, and we have a very integrated approach. We work with the girls to help them with the awareness, the knowledge and information. We also work with the teachers and the child clubs in terms of ensuring that there is an enabling environment, that nobody should look at you or shun you because you are having your periods, which is a very natural process every month. So that way we are working in terms of trying to break the taboos and the discrimination, also ensure that whenever there is need, women and girls can access these facilities.
Sanitation has become one of the biggest challenge for the Nepalese girls and women, as we have already mentioned. But how has this impacted the overall well-being of women in the country?
I think generally because of lack of safe water or good hygiene or even proper sanitation facilities, everybody, whether man or woman or would be affected by this, right? It's holding you back. It's basically something so fundamental you need for your daily living that if you don't have access to these services, you are being held back. There is a key barrier to your progress, your health, your well-being. Now, looking at how women and girls face further discrimination and have, because of the gender roles and because of the discriminations, this would add a double burden to them. So how difficult it is for a male to use those toilets without water or proper facilities, I think it would be even more challenging for women and girls. So we do feel that it does put stress in terms of their emotional well-being, in terms of their safety, in terms of how dignified they might feel, and that would hold you back. We do see that in many, especially areas where we work in schools, where, for example, girls might miss their school because they are on their periods, because they're either afraid that they may not have proper facilities in the school, or they might be teased if you have a stain, or you will feel very uncomfortable throughout the day if you don't have these accessible facilities. So that means you're already missing out on your education. So if you are being pushed to that every time, then that means you're being held back. You're not able to meet your full potential. So I feel that does play a key role in terms of the barriers that women and girls would face for their growth and their potential in the future as well.
Sanitation and hygiene is one of the preconditions to ensure people's safety from COVID-19. How challenging has this initiative become in the COVID-19 context?
I think COVID-19 has really shaken the whole world. It's shaken all of us as individuals because the idea of, I think, basic sanitation, hygiene, access to water and soap has become even more important now, because we do see, and I think it's been years and years of research and years of work that does provide evidence to say that a simple act of hand washing can prevent so much diseases, can keep your children safe and healthy. Drinking safe water without any contamination is very important for your health. You don't have to suffer from preventable diseases like diarrhea, which so many children in Nepal still face in many parts of the country. So I feel it's become more important in the advent of such a big challenge like COVID-19 happening to the whole world, including in Nepal. So one of the on the positive sides, I feel that there is greater importance of, for example, hygiene in the context that helps us advocate and helps us lobby for the prioritization of hygiene in the government plans, for example, or how we work towards it, building the capacity, investing in it. Alongside, there's also more and more realization that we need to have facilities where people are able to get water, right? If you don't have water, then that's very difficult to maintain your basic hygiene. So that's also, something that helps you ensure that access to water is available. But in the context of this current challenge, being able to deliver our work on the ground has been difficult. So it has been important to adapt and bring in new ways of working. So over time, I think we've learned how to adapt. We've used a lot of online mechanisms, for example. Even if in our own ways of working, we do depend on virtual meetings, even virtual trainings, sessions, try to make it as lively as possible, use more social media. But at the same time, because we also need to move around, we have adopted more of the preventive behaviors like wearing a mask, distancing, being in open ventilated spaces, for example, and of course always promoting hand washing, as well as following it ourselves with soap and water. Where you don't have soap and water, we carry our sanitizers as well, but that may not be always available and accessible for everybody. So we do promote that we need to have access to safe water and sanitation and hygiene, plus hand washing facilities for everybody in the far-reached and marginalized communities as well.
How easy it is for you, or like for your organization, to convince people to use these products that they haven't used before?
We're trying to make sure that everybody has information about the various kinds of, for example, when we talked about menstrual hygiene, different kinds of menstrual hygiene products. When you talk about soap, all soap, every soap is good. We don't go after any brands. Sanitizers, whatever sanitizer, whatever is accessible and whatever is easy, accessible, affordable, people want to use it, I think it's their choice. However, in terms of the behavior change, whether it is in rural areas or in urban populations, we do realize, and we have learned, that hygiene behavior change is difficult, and we need to follow different kinds of ways to motivate and inspire people to be practicing hygiene behaviors, because it is at the end of the day for yourself and not for anybody else. So we have done a lot of rigorous research, again, worked with different communities as well as different sort of setting. So we have been promoting hygiene behavior change, which is based on a behavior change design approach, and that really is building on the foundations that people need to be motivated, right? There needs to be some sort of affiliation and motivation for people to want to practice the behavior. It cannot be taught. It needs to be, a self-realization, a self-motivation and inspiration. So we use that kind of hygiene behavior change packages, which are usually quite creative, quite engaging, depending on your audience, whether it's a child or an elderly person or, an adolescent girl or a boy. So depending on that, we have been building these different kinds of creative packages, and we've been promoting these behaviors. And in COVID-19 too, we followed the same approach. We designed some hygiene behavior change campaigns and creative, media, social media, different kinds of things that we thought might reach people and motivate them. And we feel so far it has been quite successful to be able to, for example, promote again wearing masks, washing your hands, whether it's with soap and water or using sanitizer, whatever is available, distancing. So we feel that has been quite helpful, but it needs continuous nudging. It needs continuous reminders. It's not a one-off activity. It's an ongoing process of helping bring social change using different kinds of creative methods.
Let's just talk about your journey as country director.
I really like the job and the kind of role that I get to play, being the country director of Water Aid in Nepal. And even before this, because I was a development practitioner, I really feel motivated and inspired to be in the sector. And when I came into Water Aid, I got very much more inspired and purposeful because of the focus of this organization, the dedication, the strategic clarity that the organization has, and how it's been continuously working to help bring change, and that also with a purpose of ensuring that everybody has access to these three basic fundamental things like water, sanitation, hygiene. Sounds very basic and very normal, but it's still not normal for everybody to be able to get this just close to your homes or in your homes. So I feel that it's I really feel very happy to be part of this mission, and so far it has been a very good learning experience.
How difficult it is for you to be in the development sector, being a woman?
I think first the development sector I feel is one of the most more enabling sectors, because I feel the foundations of this sector is very much based on values around human rights and equality and justice. So I feel the sector is actually quite an enabling one. If you look at it, how it's come across through history, it's always been one where it's driven by social service and the motive to help bring change and then be part of that change process. Now, as a woman, I feel in my personal journey, I do feel that we all still live in sort of patriarchal society where there are certain hierarchies, stereotypes around gender roles, and even maybe creating jobs in ways that could be stereotyped. However, I also feel that given the enabling conditions for every girl, if you have a good education, if you are able to sort of voice your opinion, you are provided that enabling environment, if you have access to safe water, sanitation, hygiene, you are still able to fulfill your potential, you're still able to become that leader or person that you're supposed to be. So I think that's my experience. I wouldn't say that there aren't any challenges, but if you have been given the ammunition to be able to tackle those challenges, which I think every young girl should get, you can do it, and you can possibly be in the sector and become an influencer, a leader, whatever role you play. We don't have to become country directors to be good leaders, right? So I think with those enabling conditions, and it happens with your household, it starts with your household, it starts with your schooling, it starts with the kind of environment that your organization might give. And with the organizations like WaterAid or others, international NGOs, we have very good policies, I feel, around human resource policies that are gender friendly, that they are enabling, that they pay a lot of attention to things like safeguarding. They're always promoting an environment where people feel safe and dignified and motivated. So I feel that the sector that I'm in is quite enabling. Of course, there are still challenges. We cannot romanticize that, but it's really up to each individual. And I would just say that every girl deserves to reach her potential.
And finally, what messages do you have for our audiences, being a country director of WaterAid?
I mean, because I am very much determined to make sure that our purpose, the purpose of WaterAid in Nepal, is fulfilled, I would say that as people, we need to respect the right to water and sanitation of everybody in the country. And we also need to value the services that we get, because we have very unequal reach of these services, right? So if we already have the reach, I think we need to value it, because we are now faced with so many challenges, like for example, climate change. We don't know that the hazards around climate change might result in people having even less access to good water, right? There are still challenges around sanitation services. There maybe tomorrow it will be more difficult to have services that are accessible. So those of us who have access, I think we need to value it, use it properly, be responsible around it. And then we also need to be part of a greater purpose to help make sure that water and sanitation is prioritized, that it is given that prioritization in government plans and policies and investments, so everybody in the country has that service irrespective and of the same quality. It should not be because you can pay a little bit more, you get safe water, and because you can't pay any money, you have to drink dirty water. I think that is fundamentally unjust, and something is not right there. So I just want to request and suggest that we become part of that bigger change, and that we break these taboos around menstrual hygiene, which is definitely holding girls back, and we create that enabling environment so everybody enjoys the basic services that are essential for us to live, again, healthy, safe, dignified lives.
Thank you so much, Ms. Tripti Rai. It was lovely to have you in our show.
Thank you so much. It was lovely speaking to you.
Thank you. So thank you so much for being with us and watching our show. Thank you. Namaste.